Hi, my name is Kari Nadeau, and I'm at Harvard University in the Public Health School. I'm very excited to be here today so that we can announce the Keystone Symposium on climate change and emerging threats in infectious diseases. And I'm very excited to be joined by my co-host as well. So thank you.
Hi, my name is Stewart-Ibarra. I'm the Executive Director of the Interamericano Institute for Global Change Research, the IAI, and I'm thrilled to be here to share information about the upcoming global conference on climate change and infectious disease threats, which will be held in Hannover, Germany in June 2025 with Keystone Symposium. The vision of the group was the critical need to convene leading experts from around the world working at the nexus of climate and health, so we could understand the state of knowledge and the gaps to inform policy decisions and other actions that need to be taken by civil society and the private sector.
The reason I'm so excited about this is because there's a lot of knowledge now, even over the past 2 years, of how we can use artificial intelligence and data science in terms of being able to monitor emerging threats like infectious diseases. And within the context of climate change, that's even more paramount as we think about how can we use monitoring around the world effectively to solve some of these issues around being able to predict when an infectious disease might occur. So to me, that type of knowledge between AI, data science, as Anna said, this is about infectious disease and climate change, but it's also bringing together people in fields that aren't necessarily focused on climate change and infectious diseases, but that their knowledge will help us penetrate into some of the key questions around infectious disease threats and climate change.
I'm really excited to hear about emerging evidence on how we can better forecast and develop early warning models to predict infectious disease outbreaks using climate information. So again, with increases in computing power, increases in access to digital data, our ability today to understand historical patterns in disease outbreaks and then forecast into the future is growing. We have growing capacity to do this. And at the same time, we see a huge demand from countries around the world to incorporate into their health systems this sort of capacity to be able to forecast impending disease outbreaks, and by forecasting, then take early action to reduce the number of illnesses and deaths in their country.
I'm very excited about this Keystone meeting moving the field forward to understand how emerging threats of infectious diseases is really a reflection of our immune system. I am a clinician as well. I treat patients for allergy, asthma, and immunology. I'm seeing more and more infections where I live. We're seeing spreads of infections that otherwise would have never hit parts of the US or Europe or other countries. And now we're seeing dengue and trypanosomiasis and other diseases that we wouldn't have otherwise seen. So this is just in my daily life as a clinician. So I think that as a scientist as well, the Keystone Symposium is going to bring up ideas as well as new hypothesis testing that we can think about scientifically to move our own research forward, which I think is imperative, as well as establish collaborations that are key to be able to understand how the host immune response is going to vary overall during events like heat stress, during events like drought and flooding, during events like evacuation or wildfire smoke or air pollution increasing. All of this affects vectors or affects infectious diseases themselves, like microbes. But in addition, it also affects the immune system, not only of humans, but also of animals. So I'm excited that this is going to help on the clinical side, as well as on the scientific side for researchers to establish collaborations and also establish new research hypotheses to move forward with.
Yeah, I want to build on what Kari said. And I think having people sit down together who come from different disciplines, different backgrounds. In this case, we're bridging climate and health, but there will be people in the room who are more from the policy sector or even funders with the scientists from academia. So this is a critical step forward to be able to, first of all, reconceive the problems when you bring different people together, how we think about and frame the problems is different, especially as we're bringing people together from different countries around the world. And then together, how can we co-create those solutions and move together through the partnerships that Kari mentioned? I think one of the threads through the conference will also be about how do we build equitable partnerships that cut across disciplinary silos, geographic regions, because that's what we need to be able to move the field forward and come up with concrete solutions to address the really critical issues that we're facing today. I think this is all about building relationships. And so being in a smaller space provides more intimacy to get to know each other, build, start or strengthen our friendships. And that's not possible when you're in these huge meetings with thousands of people. That said, we've been very purposeful that this needs to be a meeting that is accessible to people around the world. That equity is very important and diversity of representation. And that's why we really encourage people to submit abstracts and apply for scholarships to come. We have already been very purposeful in designing the agenda itself and inviting experts from around the world. But we need other people who are not the usual suspects to apply and come, because for the community to grow and to move forward, we need new perspectives and innovation. And so this is a unique opportunity to build and forge those relationships, I think, that will carry the field forward for the next decade. I would really encourage early career researchers to apply, to come and share their work. I'm sure we have a lot to learn from what's happening in the space of early career researchers. Also, people who are more on the practitioner side, perhaps people who are in the public health sector, who are co-developing really innovative solutions to address these emerging infectious disease threats. We need we need to know what's happening around the world so that we can see these best practices, adapt them, learn from each other, and figure out how these solutions can be applied and scaled across different contexts. I would also really encourage people from the climate science side to come, because often in these sorts of meetings, we get a lot of researchers who are more on the health side, maybe microbiology, disease ecology. But if we want to have a true conversation about climate and health, we need the climate scientists to be at the table and to represent and discuss sort of the products and the analysis and their perspective on what can be done. Join us in Hannover, Germany in June 2025 for the Keystone Symposia on climate change and infectious disease threats. Researchers and experts from around the world will convene for this exciting conference to discuss the current state of knowledge and concrete actions to address the rising threats of climate change on health.